Oh, hello. First live, it's 2:30. I'm actually running 2 lives at the same time on the Fisher Plastic Surgery channel and on the Unique channel. And starting to get some viewers. That's cool. Welcome aboard. This is the first time I've ever done live. So we're just going to give it a shot. We're going to go from there. And for the people who just got here, running 2 lives at the same time, 1 stream on the Fisher Plastic Surgery channel. That's you over there. Can you hear me over there? Cool. And 1 stream over here on Unique Aesthetics. Probably going to do about half an hour, 45 minutes, depending on how interested you guys are here in hearing everything. Did I say everything? Really could be anything that you want to talk about. So I've actually got a question on the Unique site saying, who is a good candidate for ab etching? Well, why don't we just start off with that? So what is ab etching? Well, ab etching is when we do liposuction in the abdominal wall and we are creating shadows and highlights of the abdominal musculature. So we're usually making that champagne trough up here and defining the lateral part of the rectus muscles. The rectus muscles are the 6-pack muscles. In female patients, a lot of times we're just trying to make people look a little bit more fit. We're not trying to create crazy, Incredible Hulk little kid costumes by carving a bunch of 6-packs in. And men, we usually do a little bit more definition over the muscles. So ab etching is a way for us to give higher definition to the abdominal wall. Being a good candidate for that is somebody who has good skin quality, because if you have a lot of loose skin, you have a lot of stretch marks, you have very loose skin quality after losing a lot of weight, that skin's not going to really shrink down in the way that we want. If people have a really big belly and they need to lose weight before the surgery, they should probably do that anyway, no matter what type of procedure we're doing. But sometimes the ab etching just doesn't look right, because how many fit people do you see who also have a lot of intra-abdominal weight? So you want to be a little bit more fit in overall status, and people who have the best muscle tone. Because if you have good muscle tone, then that allows me to define the muscle, and we're really just kind of helping bring out that muscle and make it more visible. Because you want things to look natural, you don't want things to look carved on. So that's a good question. That's the first question of the first live. So let's see what we've got here. Let's go to the Fisher Plastic Surgery side. Thank you. I just have a patient who said, Dr. Fisher, she had her BBL in 2016 and she's still looking great. Well, that's good. And that brings up a very important point. Another question, I just came up with this question myself. People always ask, how long does a fat transfer last and do I need to do it again? Well, the answer is the fat should be permanent. And in my patients, they really maintain more than 90% of their volume. So you really shouldn't have to do this more than once. I just had a patient recently, 2 patients, one who was 12 years after her surgery. She came back for a mommy makeover. She looked exactly the same way that she looked 12 years ago. And then I just did a second fat transfer, a secondary fat transfer on somebody that I did a fat transfer on 11 years ago, and she just wanted a little bit more. So these are permanent things, but 2016, I'm happy that you're still looking good. So let's see what we've got here. Someone wants 360-degree lipo and also wants a tummy tuck. That is an extremely good question. What to do with that and how to approach that? Well, there are lots of different approaches, and there are a lot of doctors who will do full body lipo all the way around while they're doing a tummy tuck or a mommy makeover. As many of you know, that's not my philosophy. I like to separate out those procedures, especially if we're going to be doing a fat transfer. And there are lots of reasons for that. For most patients, that's a lot of surgery. To add a full body liposuction, you're already adding that on top of a mommy makeover. The surgery times start to get a little bit longer. So that's a first consideration. The second one, it's a little controversial, whether or not it's safe to do liposuction in the abdomen. There's a lot of data out there, there's a lot of research, and there are a lot of doctors who very successfully do liposuction in the abdominal wall while doing a tummy tuck. So can it be done? Yes. But there's a little bit more risk of damage to the blood vessels that keep that skin alive, and sometimes there can be issues with wound healing. So if my patients want to do a liposuction procedure and get the best contour possible, especially if they're doing a fat transfer, I usually recommend that they do the liposuction procedure first. And the reason for that, we can do the liposuction at a little bit higher weight. It allows me to get a little bit better contour because we can do more liposuction when we're doing the liposuction alone. And a lot of times, the skin will shrink down enough so that those patients who thought that they needed a tummy tuck don't even come back for the tummy tuck. And you've saved yourself a surgery. Even if we do need to do that tummy tuck, a lot of times the skin on the side shrinks down and we can make that incision a little bit shorter. The other thing is it gives patients a little bit of time to lose weight before they do the tummy tuck. And the lower you are and the closer you are to the weight you want to be before a tummy tuck, the tighter we can make those muscles when we repair the muscles, and the flatter we can make your stomach, and the more skin we can remove. So that's another reason why it's good, in my opinion, to stage a full body liposuction procedure and a tummy tuck or a mommy makeover. Let's go over to this side. So we are running 2 streams for those of you who don't know. This is Unique Aesthetic Center. Welcome aboard. If you just got here, Fisher Plastic Surgery. Really great to see all of you, by the way. I didn't get a chance to say that. I just kind of jumped right into this. It's my first time doing a live. And I'm looking forward to doing more of these, not just answering clinical questions, but just seeing how you're doing. Kind of letting you in to my life sometimes might just surprise you. But really, really enjoying this. It's good to see that there are a lot of people out there, and I'm going to try to actually answer some of your questions and look at some of your comments too. So let's see if I can get a question. So there's a question here, and this is a patient asking a question. This is a pretty common question. How do I get in touch with you? Well, the best way to get in touch with me really is to contact Unique Aesthetic Center. That's the office. The phone number is 305-800-2525. You can direct message through the Unique Aesthetic Center Instagram site. I suppose I could also give you a free coupon for a Google search, because people always say, oh, I couldn't find you. Well, there is the internet, but you found me already. So contact me, and the best way to contact me really is through Unique Aesthetic Center. And for those of you who tend to direct message me on the Fisher Plastic Surgery side, I'm pretty busy. I do a lot of surgeries. I'm running around. You're probably going to have a lot better chance of getting your direct message answered if you're direct messaging the staff at Unique Aesthetic Center. So let's take a look. Hi, Doc. I would like 360 lipo. Oh, that's the same question I already answered. So that's me, new to live. I'm answering the same one again. I mean, we could do that again, but I don't think that'd be very interesting. What would make someone disqualify for surgery? Well, that's a tough one. So whenever we're talking about who's qualified for surgery and not, we always have to think about the patient's safety first. That's the first thing we have to think about whenever we do anything. So there are a lot of patients out there who want to have surgery, but for whatever reason, medical history or current medical problems, their weight, whatever's going on, even sometimes the events that are going on in their life, they're just not right for surgery or ready for surgery at that time. So the first thing that we always do is get in touch with the patients. We see about their medical history, about their past medical history, and if there's something, a patient's had a heart attack, a patient's had a stroke in the past, in my opinion, those are not candidates for surgery that they don't have to have. In other words, these are elective surgeries. These are surgeries that people don't have to have. And we want to have people who are healthy enough to have those surgeries, because you don't want to take extra risks. I mean, yes, these are important things for people to do. You want to feel better about yourself. You want to have a good experience, but we always want to minimize the chance that you're going to have an issue. So things that could disqualify patients from surgery are chronic health problems that we can't manage. They are past medical problems, like a blood clot that went to the lungs. Well, I mean, could you do surgery after that? Not a good idea, because you might get another blood clot. These are just examples of things that could disqualify someone. And the best way to know is to contact our office. We'll actually review your file and review your medical history, and we'll give you a very honest answer, because this is really about minimizing issues, minimizing the risks that you have doing these types of procedures, and helping you move forward. And then there are things that patients can control that may disqualify them when they call in, but that we can work on. If you get a patient who is 200 pounds overweight, that's a little bit of an exaggeration, but if somebody needs to lose a massive amount of weight before they can do surgery, that's something that we can help you with. We can get you in touch with people that can get you ready for surgery. So even if you're not ready for surgery on the day that you contact us, a lot of things we can manage or we can optimize so that you would qualify for surgery at a later date. And sometimes, especially with things like weight loss, I kind of recommend to patients, try to at least in your mind get a surgical date on the schedule. And that way it at least gives you something to motivate you to get whatever you need to do ready so that you can do surgery at a later date. If you just say, he's told me I need to lose 30 pounds, I guess I got to lose 30 pounds, and because I can't do the surgery now because of wherever I am, you kind of never get there. So those are the kinds of the things that can disqualify patients, but really the best way to know those things is to call us or contact us by email, and we'll be able to kind of tell you about your specific issues. So one of the questions I have over here is, how many procedures can you do in a mommy makeover? Well, that depends on what you call a procedure, because if you really look at a mommy makeover, sometimes it's actually 4 procedures before we even finish calling it a mommy makeover. If we're doing a tummy tuck, that's 1 procedure. We're adding liposuction. Usually we're doing liposuction at least of the flank area, which is the region at the waist. We are doing a breast lift and a breast implant. That's just an example of one thing that's called a mommy makeover. We consider that kind of 1 procedure, but if you really look at it, that's 4 procedures in 1. So really it just depends on which procedures you're looking for. A lot of patients want to do liposuction of their entire back. And that is something that we frequently do. That's not really adding an extra procedure, but that's something that we do quite frequently when we're doing a mommy makeover. So it really just depends on what you're doing. Massive procedures where we're doing a breast lift, implants, tummy tuck, arm lift, thigh lift, in the right patient, those procedures can be done all as 1 procedure. But a lot of times I will split those into 2 procedures to decrease the amount of time that patients are in surgery, because that's very important. We know that the risks of issues like blood clots in the legs goes up with longer surgery times. And sometimes it's just a lot for patients to recover from. So we work with the patients, and once again, we always look at the individual patient and what procedures they want to do. It's kind of fun. I got to admit, since this is my first live ever, it's a little bit strange. Any of you who actually know me know that I love talking. I could probably talk for 12 hours straight. And it's kind of strange to know that you're all out there and you can't actually interrupt me. But I'm going to interrupt myself by actually answering some questions. So let's take a look here. So there's a question just about the cost of a procedure. That's a very common question I get in comments whenever I post on my Instagram, which unfortunately is not often enough. That's something really you should discuss with the staff at Unique. Either direct message them, you can email them, or call the office. Those are not, luckily, the best part about my job is I don't do anything with that whole side of things. And it's constantly changing. I have patients who come in and they say, I'm glad I was able to take advantage of the special. And I always say, what special? So that's the best thing to do, is to contact Unique Aesthetic Center. Let's answer another question here. Good question here. Dr. Fisher, I had a BBL with you back in June, and I recently noticed I have more stretch marks on my booty. Is that normal? And if so, what happened? Well, I can answer you directly. It's not very common. It doesn't happen a lot. We can't really explain why. Patients who get a fat transfer, or patients who get a breast augmentation where we're really stretching the skin, why they don't get stretch marks more frequently. So it's a little unfortunate that you develop some stretch marks, but the good news for all the other patients out there is that while it could happen, and that can be something that can happen, it's extremely rare. So yes, it's within the normal possibility, but we don't see that common. commonly. And a lot of times that goes to the quality of a patient's skin. There are certain people that develop stretch marks. A very good friend of mine is 95 pounds most of the time, and she got up to 210 pounds for both of her pregnancies. She doubled her weight, didn't get one stretch mark. I mean, that's not fair. I mean, I probably shouldn't tell you this, but I mean, I think when I was like a baby, I was a little chunky. I even have stretch marks on my butt, and I didn't even have fat transfer. I mean, I got nothing. And I actually got stretch marks, which is why I can't be short, bald, and fat, because I'd probably have stretch marks all over myself. So some people are stretch mark makers, and some people got lucky, and the quality of their skin just beats all odds, but it's not very common. A question over here, do you do tummy tuck revisions? Well, hopefully not on my own patients, but yeah, there are a lot of patients who have had tummy tucks before, and for whatever reason, they need to have or want to have a second procedure. Sometimes it's that they had a tummy tuck earlier in life. They either gained and lost weight, or they had another pregnancy or several pregnancies, and they have more loose skin. Tummy tuck revisions are not as straightforward and easy as everyone would think, because sometimes people have a little bit of loose skin, and they don't have enough loose skin to do a tummy tuck completely. Sometimes we can get lucky and we can remove a little bit of skin and do kind of an extended scar revision. But yeah, there are a lot of patients who come in for secondary tummy tucks. And one of the most important things that we need to figure out between the patient and me is, do you have enough loose skin to do the procedure again? Unfortunately, if you have a previous tummy tuck and you've got a very high scar, or you've got a belly button that closed completely, we can try to make those things better, but sometimes, like all revisional surgery, sometimes there's nothing we can do. So once again, that goes on an individual case basis. As you all know from following along, I'm extremely honest with patients about things. I don't try to sugarcoat things, and if I think that we can't make things better, that's something that we would tell you before you came here. So I'm just reading a question here. So good question. And I'm going to quote this. This is not my word, although it's kind of brilliant. Fisher, when can I get my titties done after BBL? So that's a very good question, because a lot of people come down here, they do their fat transfer first because they want to get their body in good proportion. They are at the right weight for it. First, I'm just going to preface this by repeating a little bit of something that I said before. I don't do breast surgery, or really almost any other surgery, at the same time as a fat transfer or a BBL. And the reason for that is you'd have to lie on your stomach after the fat transfer, otherwise all the fat goes away, and you can't lay on the breasts right after surgery. So theoretically, if you are extra tough and your body is ready, you could have another surgery 3 weeks after your fat transfer. 3 weeks. And the reason for that is, you can sit. You can sit in surgery, you can lay down in surgery, and you can sit after surgery. Now, not a lot of patients are really ready to sit after surgery, ready to have a second surgery 3 weeks after their fat transfer. But if you're that highly motivated patient and your body is ready for another surgery, that would be technically the earliest that we could go back and do surgery. But the reality is, most patients wait at least 3 months or 6 months, depending on how they're feeling with the recovery. But that's a very good question. And here's a question that goes back a little bit to something that we spoke about before. Would you recommend a tummy tuck if you're not done having children? So first of all, I never recommend that people have elective surgery. I never tell people that that's something that they need to do. But a lot of people want to have elective surgery. It depends on what stage in your life you are. Sometimes we have people who had a child very young, they're 22 years old, and they have a baby, and they've got some loose skin, and they can't do anything about it, and they don't know if and when they're going to have children in the future, and they're miserable about their stomach, and they've got some stretch marks. I think it's a totally reasonable thing to do a tummy tuck at that point. The only risk that you've got if you do a tummy tuck and you have children later is that you may have some loose skin and you might need a second tummy tuck. That's a possibility. Doesn't always happen that way, and there are lots of women who have a tummy tuck. They have children after that, and they're able to just go on and they look good. There are a lot of myths out there too. People are worried that if they've had a tummy tuck, they're going to be so tight that the baby can't grow. That's not true. Your body and nature are way stronger than anything I can do. So the baby will grow. It's not that we're going to make things too tight and it's going to make the baby small or not able to grow. And then, of course, everybody always has those kind of nightmarish alien views where, oh, you did my tummy tuck 12 years ago and my stomach is going to rip open and the baby's going to fly out like Alien. I mean, great for the movies, but doesn't happen. So yes, it's possible to have a tummy tuck and then have more children later. That being said, if you are thinking about having a tummy tuck, and more importantly, you're thinking about having children a year or two in the future, you're probably better off just waiting until you're done if you have an early plan for having more children. Because you don't want to do surgery in 2020, have your tummy tuck, and then decide to have a baby in 2021 and compromise your results right after. So it really just depends on what your medium-term plans are for family planning. So let's take a look down here for some other comments. There's a patient here who says, I can't wait to meet you on October 22nd. October 22nd? But it's November now. I guess that's 2021. Yeah, we're booked pretty far out. So there's a patient who's asking, if she books for a lipo and BBL, can she switch to... I don't know if she's asking if she can switch to ab etching. Oh, switch to an abdominoplasty instead of doing liposuction. Good question. So let's say you've decided in your heart of hearts that you want to do a liposuction and a BBL. And we book you for that, and you come all the way down for surgery, and it's the day of surgery, and the last second before your surgery, you say, Dr. Fisher, I think I want a tummy tuck. Not really a good idea to change your surgery plan the day of surgery. And the reason for that is very simple. If you come down for a liposuction, the advantage of doing a liposuction is you're not going to have a scar. And if you're deciding that the day of surgery, I don't really like to change the plan the day of surgery. Now, if you decide to change your plan well before surgery and you've got clear in your mind that you booked for one thing and you want to do something else, no problem. Call the office. We'll talk to you about it. If you're a good candidate for the procedure you want to change to, no problem at all. We want you to be happy. We're not going to just do the procedure on you that you booked the first time. So yeah, so definitely we want you to feel comfortable with the procedure you're going to do, but it's not really a good idea to make a big change in the type of procedure you're doing the day of surgery. Unless there's a really important reason to do that where we've gotten together and we're really clear and on the same page for that. So there, I've got a question from the gallery.
In the day they can add something?
Good question. So asked by the people who are actually reading the comments right now. So the question that is really related to this is, what if you get down here and you've decided to do liposuction of your whole body, and then on the airplane on the way down, you're like, oh my God, my arms, I want to do my arms and my inner thighs. It's okay to add those areas on while you're here. One thing I can tell you is that probably 75% of the patients who have liposuction with me are adding on either the arms or the chin or the inner thighs. Those are the three most common areas that people are adding on. My advice to most patients is, if you're thinking about adding on extra areas, you should just go ahead and do it. Because if you are already having the surgery and you're already having a recovery, then you just have one recovery. And sometimes I get patients and they come down, they do their liposuction, they come back a year later and they say, Dr. Fisher, I'm super happy, I love this, I love that, I love this, but oh no, what about my arms? I don't really like the way they look. And then we have to do another surgery, and then it actually costs them more money because that's the way things work. Once they open up the operating room, it's a whole other surgery. More importantly, they cost themselves a second recovery. So if things are reasonable and you're a good candidate for those surgeries, it's reasonable to add those things on after you've come up with your original plan. So let me see if I've got a few more questions that I can answer. How long do you have to wait for round 2? Aha, good question about round 2. So this patient is asking a question about round to from a fat transfer. So first of all, we never try to plan for a round two. Not never. In most patients, we're not planning on coming back for a round two. We try to get you as far as we can towards what you want to do and where you want to go in the first round that we can. But sometimes patients want more. And sometimes we know that ahead of time. If you have a very small buttock and you have very tight skin, sometimes there's no way that we can get in more fat than we can get in. I think of fat transfer being a little bit like breast augmentation. If you are a flat-chested woman, you've never had children, and you want to have 800 cc implants, there's no way that you'll ever get those implants in one surgery. And a lot of very, very flat-chested, slender women, if they want to have big implants, they've had a couple surgeries to get there. So I'm not encouraging anybody to go out and have 3 or 4 fat transfers, but sometimes patients want a little bit more. My recommendation for patients is that they wait a minimum of 6 months before having a second procedure. And that's for 2 reasons. Number 1, for the first 6 months, your result from your first procedure is still maturing. You don't really know what you've got until you're done with that first 6 months, because the buttocks, the swelling and the inflammation needs to go down. The shape of the buttocks is going to change over time. And more importantly, the liposuction is still healing for a long time after surgery. Patients look much better 6 weeks after surgery than 6 days after surgery. And they look even better 6 months after surgery than 6 weeks after surgery, because they're losing weight, the swelling is going down, and the skin is tightening down. And that's very important. If we try to go back in before that, we don't know if we're taking out swelling, if we're taking out fat, and you really don't know what your result is yet. So minimum of 6 months for the liposuction, and it's exactly the same thing for the buttocks. We're going back in too early, we're going to end up with a lot of inflammation. We don't know where to inject the new fat. We don't know how much fat to put in. So a minimum of 6 months after a first procedure to do a second round of fat transfer. And really that's for most procedures. If you have a fat transfer and you want to have a secondary liposuction, I would recommend the same thing, a minimum of 6 months. One thing I'd like to mention today, many of you may have seen on the Unique Instagram and on the Fisher Plastic Surgery Instagram, I did post a video of me talking about a video or series of videos that a patient of mine, Courtney Vu, put out on her YouTube channel. She's not an influencer, she's a person. She's a patient just like many of you who started a YouTube channel not long before she came down here. She started it maybe 4 or 5 months ago. She has only 7 videos, and she tagged me on one of those videos that she posted on Instagram, and then I ended up on her YouTube channel, and 3 of her 7 videos were about her BBL journey, and they were great. I really, really recommend that you watch those on her YouTube channel. I posted that video on my Instagram TV. Unique has put that on their IGTV. I've given a link in my Instagram to the video that I posted on my YouTube channel. And that's kind of the unknown thing out there. So I haven't really promoted my YouTube channel, the Fisher Plastic Surgery YouTube channel, but there is a YouTube channel out there. And I've been using that channel mostly to repost some of the patient journeys that we've gone through over time. So that's where you'll find Courtney Vu's video. My highlight version of it, I really recommend that you go to her YouTube channel, her YouTube channel. There's a link in the description on my YouTube channel. So you can actually see the full videos, because I think there's a lot of information for everyone out there. She's really done an amazing job documenting her journey, like a lot of you have. But I have a YouTube channel, and I've had it for a while. I'm going to be posting a lot more on YouTube, and we may actually be doing some YouTube lives, because I think we can do a lot more interaction on that once I kind of figure out this whole live thing, because as many of you already know, this is my first live. But the Fisher Plastic Surgery YouTube channel is live. I've been using it mostly for patient education videos, and you will be seeing a lot more patient education videos going up. Right now, those education videos are really just for fat transfer, but go check it out. Subscribe, put on notifications. I will be putting content onto the Fisher Plastic Surgery YouTube channel, kind of ramping that whole project up now, mostly because I love YouTube. And yeah, so enough about that. But let me get back to answering a few more questions. And once again, thank you to everybody for being here. This is really great. It's really nice to see the engagement. I'm still an amateur at this whole live thing, so I wish I could kind of give a little bit more love back to each of these comments that all of you are putting out there. But let's take a look at another question here. So, no, that's just mostly comments. Sexy Fisher. Ooh. Wait, you must be looking at another Fisher. Is there another Fisher somewhere? Okay, thank you. That's very sweet. We like stalkers. Yeah, so there's a patient asking about me going live with you. I'm going to do that at some point. I think this first live, I'm going to kind of keep it simple. But that would be a lot of fun to go live with some future patients, go live with some past patients. We're going to get some guests on this whole thing. I'm kind of enjoying this. I hope that you're getting something out of this. Really good question over here. What is the BMI limit for mommy makeover? So let's talk about BMI. And of course, you ask a pretty straightforward question, and then because I like talking, I'll give you a long answer. But BMI it's a guideline. It's a number that was invented, I think, more than 100 years ago. It was about European women, so it really doesn't have a lot of bearing for modern people. So we use it mostly as a safety blow-off. In the state of Florida, the maximum BMI for patients to have surgery in these types of centers, not outside of a hospital setting, is a BMI of 40. So if you have a BMI of 40, you technically, by the law, can have surgery in a center just like this. But I don't operate on patients with a BMI above 35 at all, really, for any reason. And the reason for that is just a personal philosophy that if you have a BMI higher than that, we know that the BMI, even above 27, starts to increase your risk of complications from surgery. That doesn't mean that you can't have surgery with a BMI over 27, because the reality is almost everybody has a BMI over 27. So these are general guidelines, but I just set my cutoff at a BMI of 35. That being said, everybody looks a little bit different for the same weight. A man at a BMI of 35 may be very muscular and not have a lot of fat. 10 women who are 5'5" and 176 pounds will look totally different. Some people carry all their weight on the outside. Some people have a thick frame and are curvy and have hips and have a totally flat stomach. So the BMI is relative. The key thing is making sure that the BMI is at a safe level to minimize your risks of having medical issues. And then we look at you, the patient. That's really the most important thing. Because everybody looks a little bit different. And one person's BMI of 31 may not give us as much fat as somebody's BMI of 25. If you've had 3 liposuctions before and we force you to get down to a BMI of 29, you may not have any fat left. So it's a relative question, but the most important thing really for any surgery is we need to get you to a weight and a BMI so that it's as safe as we can make it. And we need to get you to a weight where we can get you the best result. So to go back to your question about a mommy makeover and BMI, we really want to look at the patient and we want to make sure that you're at a good weight for the surgery. If you're carrying too much weight in your stomach, we can make your stomach tighter, but we won't be able to make it flat. So in general, we want you to be as close to the best weight for your body that you can be before the surgery. It's a long answer to a short question. But the numbers don't mean everything, and they mean a little bit something different for each patient. But yeah, BMI over 35 in my practice, no elective surgery. And in general, we want you to be at a reasonable BMI. If we could have everybody's BMI be under 30, that would be great. But it really just depends on the patient. But great question. Oh no, I'm trying to ask you questions, but it's going too fast. Actually, it's going a little bit fast for me too, because I'm sure there are a lot of great questions out there. And I think in later lives, I may make a topic so that we can kind of cover one thing. So let's see if I got a question over here. And once again, we're running 2 streams. Thank you so much for being with me. and bearing with me first live. Man, it is going fast. How are you supposed to sleep after BBL and tummy tuck? Oh, that's a good question. So first of all, in my practice, except in an extremely, extremely rare case, you're not going to be getting a BBL and a tummy tuck anyway, because you'd have to sleep on your back, and then all the fat goes away. Now, I know that there are a lot of doctors out there who do both procedures, and it's a difficult thing. That's also another reason why I don't do all those procedures at once, because it's extremely uncomfortable for patients, and I think you end up sacrificing the quality of your BBL result, because no matter what you do, you're going to have to be on the BBL because you can't lay down on the tummy tuck. So my advice to you is do the BBL first, recover from that, and then do the tummy tuck. And even though it's 2 surgeries, you'll get a better result, in my opinion, and you get a more lasting result out of the BBL. Side to that is BBL pillows, which is not really exactly what you asked, but it kind of goes into that whole philosophy, because people say, oh, you did my BBL, he did my tummy tuck, why can't I just sit on the BBL pillow? Many of you know that I'm not a believer in the BBL pillow for 2 reasons. Number one, it really ends up being an excuse for patients to sit. And then you do your procedures together and the patients are sitting and they're laying down because they have to, because they've had a tummy tuck, and then the fat transfer goes away. And I can't tell you how many times I've had patients come from other practices that do great work. These are great doctors and they're really happy with their tummy tuck, but they got no result from the BBL, and I have to do a second BBL on them. And so we want you to avoid that. So BBL pillows are an excuse for patients to sit. And in many ways, they're dangerous, in my opinion, because they're putting pressure in the back of your legs. And I think that can lead you to an increased chance of getting blood clots in the legs. You've already got an increased chance of getting blood clots in the legs by having a tummy tuck in the first place. And then you're putting a pillow underneath your legs. So I don't combine fat transfers with tummy tucks because of the positioning and the extra time in surgery and the fact that you'd have to sit, and BBL pillows are not a solution to that. I think that they could potentially create other big problems. Great question. Not a very common question, but it's a good one. There's a question: do I do fat transfer to the calf? That is a less common procedure that's requested in my practice, and there are some doctors out there who do excellent work. That being said, I really don't like doing that procedure personally, because there is a risk, if you get swelling or you get bleeding in the calf, of actually causing compromise of the blood vessels. You can actually lose the foot. The foot can actually lose the blood supply. So there are some doctors out there who do excellent work and they do that, but that's not something I really do in my practice on a regular basis. Once again, if there's a specific case and there's a reason that we need to do that or want to do that, never say never. And I have done fat transfers of the calves before, but that's not a regular part of my practice at this time. There are some questions about pricing. Once again, for those of you who just joined, the best way to kind of know about pricing, since I'm just the doctor, I love to stay out of that whole business side of things, is to contact Unique Aesthetics. The phone number, 305-800-2525. I feel like an infomercial, but more importantly, direct message Unique Aesthetics, call them or email them. They're the ones who know all the pricing. I try to stay out of that whole part of it. I just try to take care of patients. Oh, nice. Thank you. So I have a patient who said I did surgery on her sister a week ago and she looks amazing. Well, that's what we try for. And the good news for you is I'm glad that she's happy already, but she is going to look way better 6 months after surgery, because it really takes time to see results. So if you're happy at a week, just wait till you see the real result. When the swelling goes down and the skin shrinks down, and when your sister gets to the best weight for her body, that's going to be great. But that's good to hear. We want happy patients. So let's take a look here. So here's a question about breast augmentation. What's the difference between saline implants and the gummy bear implant? Great question. So in the United States, we have 2 types of implants. We've got the saline implants, which are the saltwater implants, We fill up those implants in surgery with saline, and we've got silicone implants, also known as the gummy bear implants. And the reason they call them that is because they kind of look like a gummy bear on the outside. If you cut the implant in half, the gel kind of looks like that soft, squishy, sticky part of the gummy bear on the inside. And there are some significant differences. They are both safe. They're equally safe. They last the same amount of time. You don't have to replace them if you're not having problems. So there's a myth out there that saline implants are temporary and silicone implants are forever. Not totally true, because they might last 10 years, they might last 30 years, but you don't have to replace them every 10 years. That's a myth. But the general difference is silicone implants tend to be softer. They tend to move more naturally. They change their shape with gravity, and they feel more like natural breast tissue. So for the majority of patients, silicone implants are probably a better choice. They seem to be happier with them. Other patients, when we need to adjust the size of the implants, or we're using a small implant in a large breast, can benefit from a saline implant because we can adjust the implants a little bit more in surgery. Those implants tend to show their roundness more than a silicone implant, so they don't get lost underneath a large breast. But we have both options. But that's a good question. I'll talk about breast implants for a little bit. How much fat do we take out for surgery? That's a great question. And we take out everything. We're going to take out everything you've got. There is a limit in the state of Florida to how much fat we can take out at any one time. So if we're just doing a liposuction procedure, which can be a liposuction and fat transfer because that counts as one procedure, we can take out 4,000 cc's of fat. That's 4 liters of fat. That is equivalent of 2 bottles of this water. I mean, that is a lot of fat. It takes up a lot of space. So a lot of fat at one time. Most patients, if they have more than that, we want them to lose a little bit of weight before surgery anyway, or sometimes patients need 2 procedures, but I mean, 4 liters is a lot of fat. So if you're out there and you're watching this and you're thinking about liposuction and you're at the right weight and in the right state for this surgery, don't worry. We got you with 4 liters of fat. If we're combining a liposuction with another procedure, so if we're doing a breast augmentation with a full body lipo, we're actually limited to 1 liter of pure fat. So usually that's plenty of fat to do with a combined procedure. So if we're doing a combined procedure in the state of Florida, it's 1 liter of pure fat with another procedure, or 4 liters of fat when we're doing a liposuction procedure alone. Really, it just depends on you. But whatever areas you're deciding on doing, if we said that we can do them all at once, we're going to treat them completely. We don't kind of take a little bit and pick a little bit from everywhere. It's not the way I work. We're going to take out everything you got. So there's a question about financing. Once again, I don't know. Yes, I know, maybe. So the best way to answer all those financial questions, because I sometimes get those on my direct messaging on my Instagram, is to really forward that over to the Unique Aesthetic Center people. They're the ones who know everything. And let's see. I'm trying to read this too. So this is I'm kind of in denial. I'm in denial because I'm like, well, I'm 29 years old. Don't think I'm actually my real age, but like, I probably need reading glasses. I'm getting there. So, I'm in denial though. So that's probably why I can't see what the questions are saying. It's not really that they're going that fast, is it? Do I do brachioplasty? Okay, good question. And then I don't want to keep you guys for forever. And it is Friday afternoon, man. It's Miller time. And it's almost Thanksgiving, which, this phone's slipping. That's nice. I got this all mounted in here. Let's talk about, I might have just lost you guys. I didn't lose you guys. Okay. So yeah, it's amateur night on the live here. So the question was about brachioplasty. Do I do brachioplasty? Yes, we do brachioplasty. For those of you who don't know what a brachioplasty is, there are actually a few procedures for brachioplasty. There is a short scar brachioplasty, which is a scar that's just up in the axilla or underarm. That procedure is really reserved for people who just have a small amount of loose skin, almost like my sleeve, and it allows you to kind of just pull up that little bit of loose skin. So that's for people who have a small amount of loose skin, who could benefit from a liposuction usually and a little bit of skin removal. A more traditional brachioplasty is one that goes the full length of the arm. And that's a lot of times reserved for people who have lost a lot of weight, and they've got a lot of loose skin. The best candidates for that surgery are people who are really close to the weight they want to be. If you have a lot of fat and we try to do the brachioplasty, yes, we can take out the fat and the skin, but it doesn't look as good, and we really can't make the arm as tight as we'd like. So try to get down. We want to try to get you down to the right weight for that surgery, because a brachioplasty, even though we generally do liposuction of the arm at the same time, is mostly a skin procedure. In more advanced cases, we're actually coming all the way down and we actually extend that brachioplasty down. That's generally reserved for patients who've had massive weight loss. There are a lot of patients out there who've had massive weight loss. My advice to patients if they're considering a brachioplasty is to really think very carefully about the scars. I place the scars so they fall at the back edge of the arm. So you shouldn't see a brachioplasty scar if you got your arm up, or if your arm's at your sides, or even from behind when you're walking. But these scars are a little bit more visible. We're in Florida here. Not all of you live in a warm place, unfortunately for you. So if you're in Nebraska or Wisconsin, I guess you do cover up a lot of the year, but still the scars are a little bit more visible. So this is one of those procedures where if you're really considering it, you really want to be sure that you feel comfortable with those scars, because they usually heal quite well. But even excellent scars as a brachioplasty, it's a little bit more visible because you can't readily cover it with skin. With clothing. So let's do one more question, and then I'm going to leave you to your Friday afternoon. I wish I could take a poll on this. Is there a way to take a poll on a live? I would love to know how many of you are at work right now and watching this live. So, get back to work. But let's answer one more question. So, here we go. Coming from New York, how long do we need to stay? Great question. Stay longer than everybody else. I would love it if you stayed forever, because I could see you whenever you wanted and you could be here all the time and you could pop in and visit me like my local patients do. A lot of that depends on the surgery you're having. So patients need to be here at least one day before surgery to do their pre-op. If you're having surgery on a Monday before surgery, you need to be here on Saturday to do that pre-op, because we can't do your pre-op on the day of surgery. That being said, the time that you're here before your surgery does not count for time after surgery. Because I sometimes have patients say, I'm having a fat transfer tomorrow and I'm leaving, or I'm having a fat transfer with you today and I'm leaving tomorrow. But I've been here for 2 weeks. Well, that doesn't count. It doesn't matter how long you've been here before the surgery. It's really the time after the surgery. So if you're having a fat transfer, we usually like people to be here 6 or 7 days before surgery. The earliest a Monday patient should really think about leaving is Saturday afternoon. So whatever day you're leaving, we would prefer if you leave in the afternoon. And the reason for that is we can see you the last day you're here. If you're getting a massage that day, you can get it. We'll be able to see you, take out your drains if you have drains, and then off you can go to the airport. And for those of you who don't know, we're right around the corner from the airport. That's one of the reasons why we chose the location for this office. So whatever day you leave, try to leave a little bit later in the day. Even mid-afternoon is fine. And that way we don't lose a day. Because sometimes people say, I'm here for 5 days. I'm leaving Monday morning at 7 a.m. Well, that really means you're leaving Saturday afternoon, because the office is not open on Sunday. And there's nobody here, unfortunately, at 4 in the morning to take out your drains to make sure you get on the plane. So for fat transfer and liposuction procedures, usually we want people here 6 to 7 days. If you're having a tummy tuck type of procedure or mommy makeover, we really like you to be here a minimum of 7 days, but even up to 10 days after surgery. And the reason for that is we're not going to send you home with the drains. And you need to leave the drains in long enough to make sure you don't get a fluid collection. If we rush to try to get those drains out and you get a fluid collection wherever you are, that's not going to be good. We don't want you to have issues. We want to minimize those issues. So please, this is my request to all of you, please make sure you stay long enough after surgery. That way we can see you, you can get in the massages and the treatments that you need, and we don't have to try to take the drains out any earlier than you need. And it's always easier to go back home a little bit early than it is to try to extend things and get more time off from work. It's usually better to ask for a little bit extra and go home early than not ask for enough, and then kind of get constraints. Well, first of all, I'd like to say thank you to everybody for coming. This is, if you just signed in, this is the first live that I've ever done. I was kind of nervous about this, and you've all made it great. I can't wait to go back and look at all the comments, and that's going to direct some of the future lives. I'm not going to commit to a schedule for the lives, but we'll let you know well in advance. I think this is something that can be valuable. Let us know in comments if this has been something that's been good for you and what kind of topics you'd like to discuss. And thank you again. Thank you so much for your support on the Unique Aesthetic Center stream and on the Fisher Plastic Surgery stream. For those of you on the Fisher Plastic Surgery stream, I'm going to be posting more on Instagram. I know I said that like 1,000 times. I mean, Unique, they're seeing a lot of posts, and it's really the same person, but look for more content on my Instagram. I really thank all of you for your support, and look forward to Fisher Plastic Surgery YouTube channel. It is live. That's where the patient education videos are. Right now it's just fat transfer, but we're working on getting things out there for breast augmentation, tummy tuck, brachioplasty, facelifts, eye lift, non-invasive procedures. I'm going to be trying to get a lot of information out there for you. Expect a lot of content on the Fisher Plastic Surgery YouTube channel. Once again, I don't want to drag this on forever. Thank you so much for all of your support. Thanks for being here for this live. Thank you for the great questions. You kept me on my toes. Take care. Have a good Friday. Stay safe. Wear your masks. Don't do anything crazy over Thanksgiving. And I will see you soon in the next live, and I hope to see you soon here as a patient. So, and now...